Okay, guys, I just wanted to talk to you a little bit about the difference between a regular rhinoplasty and a revision rhinoplasty. Unfortunately, we are experiencing a larger number of revision rhinoplasties coming through as consultations for the first time in our office. Why are we seeing more revision rhinoplasties? And I think that the real reason is obviously it's sort of corresponding with the rise of social media, sort of the wish to have a certain type of nose appearance or look like a certain celebrity or whatnot. And I think these are unrealistic. And so sometimes when people go in for their original rhinoplasty, they get promised all sorts of things, and whether the rhinoplasty surgeon is experienced or not, they may deliver a result that is not to their liking, or it's overdone, in which case that may require a revision. Also, we do revisions based on the fact that people might have some breathing difficulties as the result of a rhinoplasty. So those are the common reasons for why we do it. Now, why is it more difficult to do revision rhinoplasty? And I think this is where it gets really sticky. So some people just don't understand why is a revision rhinoplasty more difficult than a regular rhinoplasty. And I think that it really boils down to the fact that because of the original rhinoplasty, you've now created an area of scar tissue formation that can sort of warp tissues, make it difficult to see, very delicate cartilage pieces. And so it becomes a little bit more challenging to shape a nose when you're dealing with so much scar tissue within it. The other issue is that oftentimes there has been a situation during a regular rhinoplasty where we use the cartilage within the nose to provide some support structure. So the most common source of that is the septum. That's that little divider in between the two halves of your nose. And it's also a very good source of cartilage for the purpose of sort of reinforcing a rhinoplasty. But when we're doing revision rhinoplasty, sometimes that bank of cartilage has been used up, and although the cartilage can grow back, it doesn't really grow back in any quality fashion. So we have to sort of look elsewhere for support structure. And oftentimes I will go to the rib. So through a little teeny incision along the rib cage, and in women we tuck it right underneath the fold of the breast, which hides beautifully. We're able to take out a little segment of cartilage from the rib, and we have now a huge amount of cartilage in which to create all sorts of support structures, contour grafts, things that will shape the nose and help control the ultimate result. So of course that adds time, that adds a little bit more complexity, that adds a little bit more to the recovery. We still do these as an outpatient, which is kind of interesting, given the fact that we are taking an extra step to take a little piece of rib out, but I think it's still a very manageable post-operative course. And for many people who have to have that revision rhinoplasty, it's well worth it.